Hi, I'm Rod Rohrich. Welcome back to Rohrich Knows Podcast, helping you become a better and more educated you. Today, we're going to talk about filler safety. And I'm really excited to have with me Dr. Bita Farrell, who's an incredible, she's an incredible anesthesiologist and an aesthetic physician from California, from LA. And I really am fascinated by what she does in educating patients on Instagram, and please follow her. And so, Bita, welcome. How are you?
Thank you, Rod. Hi, good, thanks. Thanks for having me.
It's great. So
I'm
today,
good. How are you?
I am great. So she is very unique in that she does most of her fillers, especially in the danger zones, which the whole face is a danger zone, is with high resolution ultrasound. So tell us why you do that, and then you're gonna show us some of these danger zone vessels, and she's actually self-drawn on herself already. So tell us a little bit about why ultrasound is so important, and then demonstrate to us why the whole face is a danger zone.
Thanks, Rod. And so yes, you're right. I'm an anesthesiologist, which is an extremely essential role as a physician, and also an aesthetic doctor, which is a very non-essential role. It's very elective, right? It's not necessary. Practicing anesthesia, I incorporated ultrasound to maximize safety and precision. And as my aesthetic practice grew, I saw and when fillers started to really grow in the industry, also, came the risks with them. And I saw, for me and for yourself, our motto should be first do no harm.
Right.
And for me, I would have felt awful doing something completely elective on someone and then causing harm by inadvertently putting a filler into an artery and causing a vascular occlusion. So I just wanted to maximize safety for my patients and for my practice, and also to increase precision. And I think there's a huge role for fillers in this, in aesthetic medicine, but the safety of it has become a little bit wobbly, where people are just injecting a lot of filler and doing it blindly. So I brought light to the risks. Like you said, on my social media, I brought light to a lot of, everyone about the risks that can happen with fillers, namely intravascular injection, namely intraarterial injections. Right. So I use ultrasound when I do fillers pretty much everywhere, especially, I actually don't do fillers up in the forehead very much, but if I do, I'll use an ultrasound. I don't do fillers on the nose either. But if I was to, I would use an ultrasound. But I do a lot of fillers in the piriform fossa, mid-cheek area, the temple, and also the jawline. And these are areas that are loaded with arteries. So, and a sharp needle could easily get into an artery and deposit the filler there and cause some harm.
That's right. I do nasal fillers, and if we have time, I may have you show me the lateral nasal vessels. And you're right. I think you really need to be very careful. Stay midline, stay deep, and be careful. And but let's look at the glabellar area, the supratrochlears, the temples, and these are all incredible vessels.
So again, this is a high resolution ultrasound and has a high megahertz, meaning the sound waves bounce back and forth between the screen and the tissue very rapidly to give a high resolution and a crisp picture. So firstly, I'm going to show you, we're going to start, well, why don't we just start from top to bottom? I'm going to go ahead and put it over my, and these are teeny tiny vessels that, and the two vessels that are up here, and these are going to be kind of difficult to see, but anyway, you see it pulsating, so you know it's a blood vessel. Yep. So now moving down, now the angular artery runs just next to the nasolabial fold. It's interesting because a lot of people think that the angular artery is superficial, but in some, I've seen it pretty deep here. People do a lot of periosteal injections here, but...
Yeah, the angular vessel, but in the nasolabial fold, there's a superficial branch. Because I always get very nervous when I see demos and people are injecting very superficial here. Oof.
Oh, yeah. I am
I am frightened by that.
It's right there. You can
Yep,
see.
I see it
Actually,
pulsating.
there it is.
And look how close it is below the skin, right?
This is actually, look, so it's,
Right.
you see it?
Yes, of course.
You
Yeah,
see
I
the
see it.
pulse
Yes, I see it pulsating. And look how, show the skin is right.
Yes, actually the skin is up here. So look how deep this is my bone. This is bone down here, the skin is up top. So it's actually not that superficial.
You know, a finger breath beside the nasolabial fold, you know, the vessels are fairly deep, superficial in general. But here you're seeing it very deep.
I mean, now I've come down to the nasolabial fold and it's on superficial up here.
Yes, yeah, by the nasolabial fold. Where's your skin? Where's the skin? The skin is right there.
Skin is at the top.
Yeah. So you're very superficial at the nasolabial fold.
And it's really amazing to me because these blood vessels are tiny, tiny, tiny. So you have to be really, really unlucky to get into them with a needle.
Yeah.
You know, you have to be very bad luck. So it's, for me, my angular artery runs pretty superficial along the nasolabial fold, but when it gets to the piriform fossa, it actually dives deep. So if somebody was to put a needle next to, you know, do a deep piriform fossa injection with me, they could get into a blood vessel. So, and so what I do is when I do these injections, I put my ultrasound on the piriform fossa where the filler is going to be deposited. I put a little bit of local anesthetic or ice here, some ice anesthesia, and I put my cannula entry point right here, and I guide the cannula in real time underneath my probe, under the skin, and I bring it into the piriform fossa, and then I inject.
Yeah.
These structures are not static structures, they move, and if a patient yawns or moves their mouth, that whole marking is no longer good or valid. So,
You know, it's interesting. I inject with a needle, and I go right down to bone, and you know, right on periosteum.
you just saw where my artery was.
I know. Now I know that's, but you know, I've not seen it that deep. The angular vessel, not that deep, but it's pretty.
I've seen it on quite a few people. I've seen it on quite a few people. I mean, everyone's different, but
And I think
typically it is superficial.
Yeah, and I think, you know, using a blunt cannula is probably a little safer, right, than a needle in that area.
For sure, using a blunt cannula that's larger, meaning like a 23 gauge or a 22 gauge, it's very, very unlikely for a blunt cannula, even a 25 gauge, to act like a needle and puncture an artery.
Yeah,
Yes,
you're a real trooper, Bita, because I'm ruining all of your makeup.
That's okay. I don't even know what I look like anymore. I don't even want to look.
No. I think all for education. No.
For the sake of science.
For the sake of science. No. I really appreciate you doing that. I know. Yeah.
So
Okay.
my temporal artery, you can actually see even without an ultrasound. Mine is superficial on my skin. It's like a little worm.
Yeah, and you know, that you can palpate.
This is the, it's a very thin area, especially on me. So this is just the muscle, and here's the periosteum, like I said, the bone. So in an ultrasound, the skin is always at the top, and then there's a different layers, and then here's the bone, and there's the artery right there in the middle. And I'm going to bring Doppler flow on it. You can really see this one really well, Ron. You see that?
Yes, it's beautiful, beautiful. So,
yeah, and like I said, on me, it's extremely superficial anyway. But again, when my advice for temporal artery injections is always, start out, less is more. Always start out with less than you think you need, and then and come kind of in the middle here, not on the ostium, but just right here. Put the filler right here, just to give that nice lift. But it's always safer to go, deeper in the temple areas and use a cannula, because this vessel is right here. It's a big one too.
Yeah, I like going deep. I like going deep, and I like going, one up, one over, deep, and but blunt cannula is good. But you're right. You have to stay deep in that area, and it also has less bruising when you do that. But
And you can really see it here.
Yeah, wow. Yeah, oh yes, it's beautiful. Okay, so that is exciting and frightful, but very educational.
Yeah.
And I think,
Yeah.
you know, I'm becoming an ultrasound believer. And certainly I think it's really, especially when you're teaching and learning how to do fillers, because I see so many injection panels where people are very laissez-faire, especially around the nasolabial fold. It really frightens me, injecting superficial.
Same.
And I just go, wow, that's not good.
And nasolabial folds are such a, it's usually like the first area people get trained to inject, which is terrifying.
It's terrifying.
So now I'm going to show you the facial,
Yes, right.
the facial artery, which exits out of the antigonial notch and then curls up and then becomes the angular artery, and then it gives off branches to the lips. What you'll see is as I put this on my mandible, I can feel my antigonial notch here. And when I put this on the mandible, this is a cool image because it kind of looks like a little, you can see it like a little cyclone. You can see it's kind of a little swirly thing here. And you can see the bone in front of it. And the facial artery comes right out of there.
Right at the gonial angle, yeah. Right
Yeah.
at the gonial notch, yeah, right there.
There it is, right there.
Yeah, pretty amazing. So when you inject in for jawline finesse, how do you avoid that? Look how that's right on the mandibular border.
So what I do is when I find, obviously you can feel it, but when I find it, what I do is I put my cannula entry in front or behind it, and I always point my cannula away from it.
Yep.
So if I'll come in front of it, and when I'm using a cannula, I feel pretty safe anyway, because the cannula is so polite. It just gently goes around it. It won't puncture the artery, but I usually put my entry point for my cannula just in front of the notch, and then I'll guide it in front, and then I'll guide it behind. And if I want to be really safe, then I'll put another entry point just behind the notch and point it away. So, but I do almost everything with cannula and ultrasound guidance. And when I'm doing this, I'll use ultrasound guidance and make sure that I see my cannula, glide next to or just by and say hello to the artery and just go past it.
I agree.
And then I'll deposit my filler. And when I'm depositing the filler, I also use the ultrasound to visualize live in real time depositing the filler. And another thing that makes me feel comfortable is when I see the filler coming out of the cannula tip and going into the tissue, I know that it's going into the tissue and it's not going into a blood vessel. If you push the plunger and the filler comes out and you don't see where it's going and it's under your ultrasound, it could very well be going into a vessel and you're not seeing it. So there's multiple factors, safety factors you can check with ultrasound, not just where the artery is and where the cannula is, but also when the filler is being deposited, make sure you see it going into the tissue where the tip of the cannula is. Because if you don't see, maybe the tip of the cannula has gone into a vessel and it's going into that. But again, a 23, 25 gauge cannula is very unlikely to puncture in a blood vessel.
Right. Yep. Know before you go. Know your anatomy, and I go. Less is more, and I usually use needles, and I sometimes use jawline. I use cannulas, but again, going, in front of or behind it, the facial vessel, which is the cornerstone vessel to the face. So, well, fascinating.
And also the velocity. Sorry, one more. Just the velocity and the pressure that the filler you're injecting. Do it slow and easy, because if you push too hard, too fast, might not be in a blood vessel, but you might cause like a compartment syndrome. You might compress the vessel with too much pressure and too much filler volume.
Yes, be very gentle, be very delicate, and I think that's important.
Gentle and delicate.
Yep, know your anatomy. Wow, fantastic.
Yep.
Dr. Farrell, fantastic educational safety points on filler safety. Give us your comments, give us your thoughts, and helping you become a better and more safer you, and know before you go, okay? See you next time.
Right.